Hi guys, Dr. Jornax here, and gonna go over here what we're looking for as far as posture and chiropractic goes, and really why it's so important. So the spine and the nervous system controls everything. We don't really care about the bones in the spine. People think we're bone doctors, back doctors. Really, the only thing I care about is what's inside the bones, which is the brain and the nervous system. Again, that controls every function. For your heart to beat, for you to feel things in your hand, to use your muscles, for you to digest food, for your liver to detoxify your body, to have proper motor function. Your brain is sending that information down the spinal cord, out the nerves to each organ. So when you have the proper spinal alignment, no loss of curvatures or posture or previous injuries, that can work at 100% and your body can heal and function. Obviously, traumatic events, you build scar tissue up in the body, and that stays there, you start to lose function and it starts to affect the nerves. So people coming from back pain, I'm going to help you with your back pain, but what I'm really worried about is the nerves in your low back that go to your reproductive organs. They go to your small intestine, your large intestine. So if you don't do something about that, it's not just that you're having pain, that's just a sign. That's your body just giving you a warning sign. Hey, we got to do something about this. Just like your check engine light comes on. We don't just cover up with a piece of tape, or at least we shouldn't. We need to do something about it. Our bodies are the same way. Pain is just a warning sign coming on that these organs on the other end are being affected. So this is what we should see on an X-ray or from the posture from the side. You want to have a nice curve in the neck like this. So when you have a nice curve in there, you can see the spinal cord is nice and relaxed. There's no tension. The cerebrospinal fluid, the brainstem here, is free. The problem is, when you lose the curve and the neck straightens out, it actually stretches the spinal cord by 18 to 22%, and you can see here how it's actually starting to push in on the spinal cord. Again, that can cause numbness down the hand. That can cause headaches, especially pressing here on the brainstem. It can cause mood disorders, and it can really affect anything below it. But mainly, you see heart conditions and headaches and numbness in the hands. A lot of that stemming from the neck here. Obviously neck pain too. So here is someone with a reverse curve. Again, that curve is supposed to be going the opposite direction. Can you see if you have nice disc spaces here? But right down here it starts to get arthritic and loss of disc space. That's because they've lost that curve. That's not from old age. Again, these discs are good and they're the same age as these discs. So if your doctor tells you it's because of old age, it's a bunch of BS, really, because why are these are the same age? So here's a lady, she had numbness in her hand, she had an autoimmune disorder, so fibromyalgia, always in a lot of pain, and chronic headache. She had a lot of sinus troubles, allergies, and you can see there's just tons of compression up here in the top of her neck from her neck being reversed. She'd been to chiropractors, her whole life, and she came and saw us, and she was, telling us how some of her symptoms were coming back, and so we decided to actually get an MRI because it had progressed so far. And this is her MRI. Can you see what's happening to her spinal cord right there in the middle? These discs are actually starting to compress in on the spinal cord. This is similar to a garden hose. There's water and information that's supposed to travel through your neck here, just like a garden hose. And literally, those discs in the neck are starting to compress, and that can cause anything imaginable. So that's where it becomes dangerous if this isn't addressed appropriately. So here's a cross section, a normal cervical curve. There you can see the spinal cord, loss of cervical curve here on the right. You can see how it becomes stretched, and it just puts a lot of tension on the spinal cord and can cause a whole array of problems. So again, this is what I see a lot of: straight neck here, tons of tension on the neck. Again, she had major headaches, neck pain, chronic tension, stabbing feeling in the mid-back from the pulling in the neck. And you can see this is an after. And the crazy thing, again, this lady had been seeing chiropractors for a long time, and it would get better, but she's like, I always have to come back and to get realigned. And I told her, yeah, because the curve in your neck was never addressed. The problem was never fixed. There was a temporary relief from the adjustment. But again, that makes you feel better, but I'm not worried necessarily about making you feel better. I want your body to function and heal at 100%. I want 100% information from the brain to be able to travel through the neck and innervate every organ in your body. I want your heart to work at 100%, your lungs, your digestive system, your immune system, and that in order for that to occur, we need to get these natural arcs back in the spine. Again, if you don't correct this, that's what starts to put extra pressure on those discs in the neck, causing arthritis, degeneration, and so forth. So if we can get that natural curve back in there like we did with this person, you can see these disc spaces start to open back up. She's never had a headache since then. Numbness in her arms completely went away. Said she has more energy. Her thyroid's working better. She's sleeping better. You can see these spaces at the top of her neck right here, how they started to open up. Those nerves in the back of your head control, that's where your brainstem sits. That controls mood, sleep patterns, all kinds of issues. I've seen this a lot with ADHD kids and autistic kids, a lot of compression up here. So, a lot of things in her life started to improve just by fixing this curve in her neck. The way we do that, here's a before, here's an after. The picture in the middle is them doing their rehab exercises after getting adjusted. And you can see just after one adjustment, a huge change. Originally here on the left-hand side, head was 30 millimeters forward. When the head comes forward like that, it adds anywhere from 10, 20, 30 extra pounds of compression on the neck. Just in one adjustment with the proper weights, you can see the ear comes right over the shoulders. The green line is right over the neck versus the first one. So that's kind of the pattern of weights this person was using. And you can see how his ear is directly over his shoulder. So it's this repetition. This doesn't happen overnight, this change from this to this, but every adjustment we get about 1 millimeter improvement, and then over time makes a huge difference on how you feel and how your body works. Here's of the low back. That's the surgery that the surgeons want to do on you because they don't know how to fix this. This is someone, she couldn't have kids, infertility, a couple miscarriages, digestive problems, sciatica. She even had a history of breast cancer, and we kind of, she learned about structural correction and what can be done. And this was her about 6 or 7 months later. Huge difference. And you can see she's even wearing the same pants with the button with the zipper there. Again, not everyone's going to get back to perfect. She just got really good results, but we were able to fix this, and she was able to have kids again, which was amazing, just by taking compression off the nerves in the low back. People with scoliosis know that scoliosis can take 10 years off your life, not because it looks weird, but because it damages the nerves that control the organs here. So her digestive problems started to get better. Had kids again, which she was really excited about. Obviously from a lifting standpoint, this is going to be way stronger than this. This is going to buckle and put a lot of extra stress on the pelvis, on the hips. Again, this curvature can bring that hip up and cause a lot of issues, especially when you're working out and lifting. If that's rotated in there like that, it's going to wear and tear on the body way quicker than if we get the alignment right. We have all kinds of crazy equipment that we do. Here's at my old office, our vibe plates with all our different weights we'd use. And really, one of the reasons, this is my mom and my niece, and the reason I do this, guys, isn't just to adjust people. This is about, my mom's in the best health of her life. She wanted to be there for her grandchildren. Again, it's not just about getting adjusted. It's about getting your health back. It's about getting your spine, your nervous system working right, so you can be there, for your grandchildren. You can be working out on a regular basis, not in tons of pain, not being able to, hang out with your loved ones and live life to the fullest. And my mom really is a true inspiration, and really drives a lot of what I do. So that's all I got for you guys, and appreciate it.